Go ahead.
Okay. Welcome, everyone. Thank you for joining our Burlington Resource and Recovery Center webinar on mental health, substance use, and the Vermont Office of Veterans Affairs. This is yet another webinar being organized by the RRC, which is a multi-departmental city team that is here to provide support to Burlingtonians during this COVID-19 emergency. As we go forward through this pandemic, we want to make sure that we are supporting our veterans. This is important and critical in normal times. It's especially so during this crisis that is creating stress and hardship for so many veterans. That stress includes exacerbated challenges with mental health, economic security, and substance use. We have a great panel today of local experts who are here to discuss how those challenges are unfolding for veterans and specifically what services are available to them and how to access them during this crisis. I'm pleased that one way that the city's been able to support veterans in particular was by providing the distribution of our BTV Burlington Community masks to the VA on Lakeside Avenue. And it is especially fitting that this webinar today is happening just in advance of the annual Memorial Day holiday, when our minds are very much with veterans and those that we have lost in sacrifice to the country. So to anyone that is watching today, my final point, I just want to say, anyone who watches this event, I want you to know that this RRC, this virtual center the city has set up, is there to offer help to you if you need it during this crisis. You can reach out and get one-on-one help from the RRC by phone, email, or by accessing it through the city website. So thank you all again for tuning in, and thank you again to our panel. And now I'll turn the program over to Anthony Jackson Miller, who is a parallel justice specialist with the city's Community Justice Center and is our lead at the virtual RRC for mental health. Anthony, thank you for your service and thanks for leading us here today.
Thank you, sir. Welcome all of you, and thank you so much for joining. We know there are folks from all around the state that may be joining us today, and we're grateful that you made this time. My name is Anthony Jackson Miller. I'm a victim services specialist for the Burlington Community Justice Center, which is a division of the Burlington's Community and Economic Development Office, or as we call CEDO. I'm serving currently as the mental health resource lead for the Burlington Resource and Recovery Center, or the RRC. The Burlington RRC is the city of Burlington's response to the COVID epidemic that quickly channels folks to resources that they may need through a call center and a website, which we have updated daily. We launched on March 23rd, and we have 30+ staff members from 6 city departments. Our topic today will be mental health, substance use, and the Vermont Office of Veteran Affairs. We want to address what affects the folks as far as COVID-19. We have with us today panelists Joshua Gerard. Oh, I'm gonna mess your name up. Thank you. Laura Gibson, Jonathan Schwartz, and Meghan Snitkin. So Joshua?
Yeah, hi, I am Josh Gerasimof. I'm a certified peer support specialist out of the outpatient clinic of Burlington, which is part of the White River Junction VA system. I've been in the VA for about 5 years. Prior to that, I served with the 82nd Airborne. And that's me.
I'm Laura Gibson. I'm a clinical psychologist, and I'm the Associate Chief of Mental Health for the White River Junction VA and the Director of Behavioral Health at the Burlington Lakeside Clinic, and I go by she, hers.
Hi, my name is Jonathan Schwartz. I'm a staff psychiatrist in White River Junction. I provide primarily outpatient services, both in our walk-in clinic and in our regular specialized mental health clinic.
Hi, everyone. I'm Meghan Snitkin. I'm trained as a clinical social worker. I go by the pronouns she and her. I'm currently stepping into a new role as the homeless program coordinator, which lives under mental health and behavioral services. And previous to that, I was the suicide prevention coordinator. I'm based in White River Junction, and I've been with the VA for 9 years.
So, and I forgot, I go by he, him. So our first question, which I think is the most important of all the questions, what are services that the VA is offering during COVID, and how does one access not only mental health services, but services during COVID-19?
I'll jump in on that and trust my colleagues to correct what I get wrong or add to what I miss. So we're really proud that we are able to offer the full range of behavioral health services. So we're offering 95% of our services virtually. So either by telephone or what's called VA Video Connect, which is essentially a video conference type platform like similar to Zoom. And so we're offering group and individual therapy for the full range of mental health issues. We're offering psychiatric medications. We are open to established patients, but also to new patients. We absolutely encourage you to call whether you are seeking help for something imminently related to COVID or something perhaps from years and years ago. So again, we treat the full range of mental health issues. I don't want to forget to give out the phone number. I know we'll give it out repeatedly during this call, but probably the one important phone number to start with for folks who are not already enrolled is the eligibility office for White River Junction VA, and that is 802-295-9363, extension 5118. And then if you want to reach mental health, to set up an appointment in mental health, again, whether you are new or established, whether you are seeking care anywhere in our system, you can call one central phone number, which is, again, that main number, 802-295-9363, and you can easily find that on our website. But the extension you'll use is 5760, or you can just ask for the mental health desk, and they'll get you to the right place. Megan, do you want to talk at all about homeless services?
Sure. So I'll just, I just want to reiterate what Laura Gibson said, that we're continuing to provide the full range of services that we were providing before the pandemic hit. So I'm not going to go through those services that Laura mentioned, but just want to reiterate that we're still providing our full range of services. And I don't know, Laura, if you mentioned, we do groups. And so I know that during this time when folks might feel isolated and disconnected from people in their community, we are continuing to provide groups. They are virtual. So but we have a full range of groups, whether they're psychotherapy treatment groups. We do some mindfulness-based groups as well. So if interested in getting connected to those, the numbers that were provided you can enroll in VA services, or if you're already enrolled in VA services, talk to your provider and we can get you connected to some of those groups as well. I know that a lot of folks during this time are struggling with financial hardship and may be experiencing concerns and stresses around losing their housing. So there are there's a lot of protections for folks around housing, but I do want people to know that we are still providing housing resources for folks that might be struggling. So we have an entire program here at the VA that serves veterans and their families that are experiencing homelessness or experiencing potential homelessness or needing help in that area. So the numbers that were provided can get you connected to mental health, and we can get you connected to somebody on my team and or a social worker that can help you with any of those stresses or concerns that you're having around your housing.
So what if I'm a civilian? Can I access VA services?
Well, I'll jump in, and then I was looking at Josh. Josh, you were smiling. So the VA has several missions, and our mission is to serve those who have served in the U.S. military. We do have a mission to serve civilians during a crisis that is activated through our federal system. And currently here in Vermont, that mission has not been activated. So we do and continue to serve veterans who have served in the military across the state of Vermont and our areas in New Hampshire. And at this time, we are not serving civilians.
So what does why does the VA utilize peer specialists, and what does peer support look like at the VA?
I'll go ahead and answer that one. So a peer support specialist is someone that has lived experience. All the peer specialists within the VA have served in the military, been diagnosed with mental illness, and is currently in recovery. And what they do is they kind of act like a liaison for that veteran and the VA system. Anybody that's been a part of the VA or works for the VA knows it's a huge system. There's a lot of resources. It's impossible to know each and every one of them. So sometimes that can be frustrating for the veteran. So a peer will work with that veteran to try to figure out which resources fit where and kind of guide them. And then it also works with them and with their recovery goals. They bring a unique perspective to the treatment teams that they bring. A lot of times they advocate for the veteran. Sometimes the veterans aren't quite ready to sit down with a psychiatrist or a social worker. And that's okay. They can meet with a peer and kind of just talk to them veteran to veteran and kind of show them what it's gonna look like and kind of help them along their process, let them figure out what's going to work for them. So that's what the peers do. Right now, we have 9 peers within the White River Junction VA system. We're looking to expand, so we're excited about that. And that's they do a lot of teaching and a lot of informing, I say. So like right now, one thing that I think that peers can bring to the table is connecting other veterans with other veterans. You know, right now, a lot of people are at home isolating. We run groups. So right now we run virtual groups, which are fun. They don't have to be heavy or anything. It's just kind of like a social coffee group. A lot of these veterans know each other, but unfortunately we haven't seen each other in 10 weeks, 8 weeks. So we get together and we'll just have a coffee group. And anybody who served in the military knows there's a lot of humor that goes on in the military. And it's nice to get those groups and to get that humor back. Veterans are best at beating up on other veterans and making joke in light of the situation. A lot of these veterans have been in really, really tough places. We find ourselves in another tough place, and we find out we're going to get through this together. So that's one thing veteran peer supports can do right now. Another thing is veterans have a question. What does the VA look like now? You know, I want to see my provider, and they may have, you know, this idea that the VA is closed, and that's not the issue. So the peers can kind of advocate for that veteran, and then also tell them what the VA looks like today, because it has changed. We're still open, but it may be virtually. So I spent hours on the phone working with veterans. 80-year-old veterans, trying to get them signed up so they can do virtual care, and then tell them what it's going to look like and prepare them for that. So it's a continuation of care. It's just changed a little bit. We're doing it virtually. So that's another thing that a peer can bring to the table.
Okay. And what are some of the main issues that you're seeing veterans struggle with during not only COVID-19, but that they may be struggling with when we get past lifting up some of these restrictions?
I was thinking, Jonathan, do you want to chime in? Or Laura, looked like you were going to say something.
I was hoping Jonathan might chime in too. But
yeah, sure. I mean, I think, you know, many people, you know, many veterans who have deployed have, you know, significant skills in the area of kind of acute stress management. And so I think some people have done really well at first, and now we're kind of settling into, you know, a more longer term kind of siege. And so I think a lot of people are struggling with the timeline more now than they were, say, a month ago. We're seeing substance abuse issues, and then long dormant issues, you know, depression, anxiety, can be worse during this period. So we're certainly seeing a continued demand for services, both for new people and then people who have been established in care for a while.
Yeah, I would second that. Another thing that we're seeing, which isn't real surprising, right? Because everybody's cooped up at home, parenting challenges, you know, frustration, tolerance, just trying to deal with anger and irritability, needing space and being all sort of trapped together in the household has just been hard on folks. I think it probably is for all of us. It is for veterans as well. They're talking about that. I have had one interesting thing. Many veterans cope through wanting to sort of self-isolate. And so I have had an interesting phenomenon of some people sharing, some veterans sharing that actually they're getting some respite from their symptoms right now because there's no pressure, you know, what they usually have to deal with in terms of their PTSD or anxiety being out and about in the world. They have a little bit of respite from that is socially sanctioned. And so that's been sort of interesting and unexpected, but that gets to your question, Anthony, about what might we see as things start opening up. So I think, you know, some of those issues that might be dormant, we're expecting to get probably an increase in requests for mental health and substance use assistance as things open up more and go back, you know, people settle into the new normal. We're expecting there's probably going to be a surge of requests for help.
I'll chime in on this question too. And so, you know, one of the things that, you know, many folks listening in today might have, you know, heard both through social media or, you know, on the news or on the radio that we're seeing an increase in deaths of despair. And so these are deaths by overdose, whether they're intentional or unintentional, or suicide deaths. And, you know, Vermont is not spared by this. We do have, you know, a relatively high suicide rate and deaths of despair here in our state and also among our veteran population. And so we are seeing an increase in this. And so why are we seeing this? You know, why are we hearing about this? Primarily the two driving factors are isolation and financial hardship. And so when we think about what are the things that many folks, maybe not everybody, but many folks are sort of dealing with and managing right now is, you know, isolation and financial hardship. So, you know, I know that this is not an exciting thing to talk about, but I think it's just something that we are seeing and we are going to continue to see. And we at the VA have an array of services, as we mentioned earlier, to help folks who might be struggling in these areas and to help, you know, prevent some of these deaths of despair. And so Josh mentioned we have some peer support groups. We certainly are doing groups. We have our full range of mental health services and medical services available. There is a National Veterans Crisis Line number, and I want to make sure that folks have that number. It's 1-800-273-8255. And then you would press 1 to reach the Veterans and Military Crisis Line. This is also an access point into the VA. Any family member of a veteran or veteran can call that crisis line and would immediately be speaking with a crisis clinician. And then referrals for needed follow-up land here at the VA in Vermont, and we follow up directly, whether that's connecting them to care here at the VA or in the community. So that's another way to access care if needed. And I want folks to know that that number is available 24/7, 365.
So what would be the process in order to establish, so outside of crisis, what would be the process to establish mental health care or substance use care during COVID-19?
So we've tried to streamline it to make it really as simple as possible. So if a person is already enrolled, we gave the number for eligibility for folks who are not yet enrolled. You have to start with eligibility. But if you're already enrolled in the VA, it's very simple. So for any non-emergency seeking of substance use treatment or help with any behavioral health issue, you would call 802-295-9363. Again, that main VA number, extension 5760.
And then if you are established for care, what it's going to look like, because a lot of veterans think, well, what's it going to look like now? You're going to get a call. It's likely going to be from a social worker or someone from someone in the VA. And they're going to ask you what's your preference. They're going to ask you if you're looking for the mental health care, do you want to chat over the phone? Do you want to video connect? And then they would give you those instructions, what it looks like. Me personally, I just had a primary care appointment. So I was curious to see what this is going to look like and what's it going to go through. They called me for a schedule. They asked me what my preference was. I said I wanted to go ahead and do it through video. They sent me a link. When my appointment started at 2:30, I click on that link and it opens up a room. The room is locked, as they say, and it's you sitting there with your provider and you're talking about just everything that you would talk about previously. Yeah, they can't check your blood pressure. They're not actually seeing you, but they have ways of addressing those if they do come up, if it is a concern. So it does look a little different, but you still do just like this. You sit in front of a computer screen, your iPhone works, a tablet, desktop. All you do is click on the link and it opens up a room and you're there with your provider. And it's the same way it works for mental health services. They'll send you a link, you click on it, and you're in a room with them.
And if I could just make one comment about eligibility, there certainly are people who may have looked into VA services, 10 years ago, 12 years ago, who were found to be ineligible. I would certainly encourage those people, if you want VA services, to try again. The eligibility rules do change over time. And so there certainly are people who may not have been eligible when they were in a different financial situation or based upon different rules, who now would be eligible for services. So please, don't give up on us, keep trying.
And it's never too late. Korean War veterans, World War II veterans, definitely Vietnam veterans. If you've never accessed the VA or if you've never even, tried to apply, give it a try. We're accepting all eras. If you served in uniform, it's worth seeing to see if you're eligible.
So I think along with that, so what if I'm a veteran and I'm overwhelmed right now and need some support or help, but my issue has nothing to do with my military service?
Totally not an issue. So we really treat the full range of things that people might be seeking help for. It does not need to be directly related to your military service. Another cool thing that's going on right now is because our whole system is virtual, we actually have phenomenal access right now, because given that everything is done via VA Video Connect or telephone, a veteran based in any part of the state can be connected with a provider in any part of the state. It's all sort of one playing field. So it's sort of vastly expanded our provider pool. And another cool thing that does is it brings, we have some providers who may have specific expertise in sleep or panic disorder or some very specific thing. And that provider can work with anybody in the whole network because it's all virtual. So again, doesn't need to be related to your military service directly.
So for folks that may not tune in today, but at some point in the future may tune into this, I'd like for all four of you to just talk a bit about what are some coping skills for folks as far as mental health and substance use, especially as you've spoken about, we're in a time when there's folks with mental health that are isolated. There are folks that are using substances to cope. What are some things that they can do during this time to get through, at least until they can get some support and help?
So I'll speak to that from a peer's perspective. The biggest thing with veterans when you're serving in the military, you're kind of taught to kind of just suck it up and drive on. You know, there's a mission and you got to be mission focused. That works for the military. It doesn't work in the civilian world. My biggest thing is to reach out for help. You know, call your buddy that you served with, call somebody you trust. You don't have to let them know off the top that you're struggling and get into it, but just reach out to them and have that conversation. We're all in this together. Veterans are not immune to this. Now is a great time to reach out. We have different platforms. I've spoke to a couple veterans that's been out of the military for 10, 15 years. And just now they're setting up Zoom meetings with their old platoon. And they're reaching out and they're having a really, really good time with it. And they're continuing those meetings. So you can, now's the time. And also, you know, think of it also of you're not doing it for yourself. You're also checking in on other veterans. Maybe they're not ready for that yet. And if they receive a call from you, that's pretty powerful. So that is one thing that we can do as veterans for other veterans is reach out to your buddies and just see how they're doing.
Yeah, I would sort of echo what Josh is saying. I think, you know, trying to maintain that connection with people who provide you support and who you can support is, you know, so important. It may take a different form than it may have 6 months ago, but I think that's important. I think basic self-care things. So, you know, making sure, you know, for people who are able to kind of get outside, this is the time of year in Vermont where we can actually get some real sunshine, making sure we get the vitamin D up, we get some fresh air, some exercise in a safe manner. You know, I think all the self-care stuff, it becomes so much more important now when we're all under, you know, all of us under this sort of new and unique stressors.
I've personally been very grateful that the parks have been reopening in the city of Burlington. It's lovely to see that. Getting outside, I would second what Jonathan said. It's so critical and it's beautiful, wonderful time of year. So to the extent that even if it's the last thing you feel like doing, you're just stuck to your screen, to really push yourself to get outside and get through that barrier. One thing that we haven't mentioned, I think sort of related to this, we've talked about peer supports and we've talked about our traditional mental health services. We also have rec therapy, including art therapy, and they've been doing some really innovative things, again, to get some of us couch potatoes sort of moving. Sometimes we need some extra motivation. So there have been rec therapy groups on gardening and on, you know, how to fix your bike and yoga and things like this. So those are some other resources that are available that I think help with the self-care piece.
And I'll just add, you kind of just triggered, Laura, for me that in addition to some of these rec therapy groups, our Department of Nutrition, our nutrition department, are doing some online virtual cooking classes. And so really helping folks self-care in that way by learning how to, you know, use some of the fresh produce. Pretty soon our gardens are going to be producing food. And so we live in a state where there's a lot of farms. And so there are lots of innovative groups that are happening across the VA outside of just sort of your traditional mental health care. But as Laura said, rec therapy, some cooking groups, there's probably lots of other things that are happening that the four of us might not be fully aware of. So please, reach out to us and we can get you connected to some of these other avenues of support and self-care.
And I would just also say, the issue of screens has come up a couple of times just in this brief conversation. And I think, people being mindful of the amount of time they're spending on screens. This is a fascinating experiment. And, certainly I talk to a lot of people who are a bit overwhelmed with, kind of have news overload. They watch it all during the day and all night long. And so I think some people experiment with taking a 6-hour fast from the news to try to kind of get the information they need, but not live in that moment and kind of expand their horizons a bit. And so I think just being mindful of that and its effect on sleep, anxiety can be an issue.
I love that, Jonathan. And I was just thinking how I actually have a friend, and this kind of goes along with what Joshua was saying, connecting with folks, is they do virtual runs. So they put their earbuds in and they chat with each other while they're in their own communities and doing their own outside time. So they're away from a screen, they're getting outside, they're moving their bodies, but they're connecting with folks that they either haven't seen or they used to be able to do these activities with. And so they're still able to do those activities together off of a screen, but just doing it over the phone and with earbuds. So I think there's definitely different ways to become innovative and creative with the technology that we do have and the nice weather that we're having now and is to come.
Now is the time for us all to be recharging our batteries. I think for the next 5-6 months before fall and winter in terms of sunlight outside time. And so we've got to all be mindful of that.
So I know that Joshua has explained in depth about what peer support has to offer, but I would like Megan and Laura to speak a bit about what their, mainly Megan, as you deal with or formerly dealt with the homeless population. And in Burlington, we find that a lot of folks that are housing insecure or homeless or transient are veterans. So can you speak a bit about those folks and services that may be available to them?
Mm-hmm. Absolutely. So as I mentioned earlier, we have an entire, we call it the homeless team. It's essentially a large group of social workers and peer support specialists that are spread across our catchment area. In Burlington specifically, we have and Josh, help me if I'm incorrect, we have 2 social workers and we have 1 dedicated peer support specialist on the team in Burlington. They coordinate with the local shelters and our transitional housing programs, and for folks who, may decide that they don't want to move into permanent housing. So we work with the entire spectrum of folks who might be housing insecure or have experienced homelessness. So again, if you are concerned about your housing and you're in Burlington, that number to reach the mental health department is where our sort of homeless services live under. So really easy to access that. And that number again is 802-295-9363. Main number and extension 5760. And if you are, let's say if you're unable to call that number and you're able to reach out to somebody who has a phone or an organization that you're working with, they know the social workers and the peer support specialists in Burlington quite well. We're very integrated into the community resources and the shelters and many of the folks around the city. So if you can't get in, call that number, certainly we can work with you and other avenues and creative ways to reach out.
Do you also have support for folks who are veterans that may be struggling with paying rent or struggling with finding food?
Absolutely. Thank you for that question, Anthony. So there are definitely resources specifically for veterans who are struggling with paying their rents. So again, reaching out and contacting us. I wish that I had in front of me the homeless hotline. Do you have that in front of you, Josh, by any chance?
Sorry.
Okay, we'll get it. If one of you guys could look it up, that would be great. I don't have that number memorized like I have the crisis line number memorized, but we do have a hotline that can be called, and then it funnels down directly to us in Vermont. But we do have resources, specific financial resources that we coordinate with outside agencies that can assist veterans and their families who are struggling with paying their rent. We also, and Josh might be able to speak for this a little bit more, but we have been distributing food to veterans who are unable to leave their homes for whatever reason, or don't have access to transportation, or they're vulnerable and feel like they really can't get out and get into the grocery store. And so our peers have been doing a fantastic job of distributing the food. And I don't know if you want to add anything to that, Josh, in that area.
Yeah, I think it's also a testament to the great state we live in. We're lucky enough when this happened, we identified that this could be a potential problem with getting food resources. We were able to identify some veterans that are just in that vulnerable population where we really didn't want them to have to go out to the grocery store. So we were able to work with community partners, and now we would go to these food banks and we would just say, hey, we're with the VA, we have X, Y, Z, many families we're going to be delivering food to, and they would put boxes of food in our vehicle, and then we'd go out and we would deliver it. We follow the provocations. What we do is we'll put on our mask and we'll drop it off at the door. We'll either call them and say, hey, your food was just dropped. We make sure that they have it. So it's like a no contact with the employee and the veteran. So we're making sure we're not exposing those veterans to any outside, we're just taking all those precautions. So we are doing food drops. So if you are a veteran, you are already in the VA system, and you are curious about that, I would contact, the clinic, maybe talk to the nursing staff or whatever, and let them know that that is a concern for you. And we'll just try to figure out those resources to make sure that you can get some food from the food shelf. Like I said, the state of Vermont, all the local food shelves have been really, really great with figuring out how to do this and to meet the needs of the veterans.
What are some of the things that the VA is doing in terms of suicide prevention and support? I know you spoke on it a little bit. I was wondering if you could elaborate.
Mm-hmm. So thanks for asking that question. I feel like it's a big question. I'll answer pieces of it and hope that the other panelists will chime in as well, because it's certainly not something that the VA can do alone. We can't, as an organization by ourselves, prevent suicide. So we are working with many organizations, the states, the counties, the local governments in preventing suicide among our veteran population. So it's really a joint effort. It's about doing and working with partnerships. And so we really have to all work together to prevent suicide. So we have sort of that larger issue, the larger idea that suicide prevention is our #1 clinical priority at the VA. We put a lot of resources into suicide prevention on many different levels. And so one of them is really working with a larger community on education. So we do a lot of education on what are risk factors, what are warning signs. I know those might be terms that are kind of thrown around, but as I mentioned earlier, we know that some risk factors are isolation and financial despair. So, so those are two things that folks might be experiencing that can put them at increased risk for suicide. Substance use, for example, is another one of those. So we provide a lot of education around to both veterans directly and organizations that serve veterans. I'm going to ask other people on the panel to kind of talk about maybe some other things. We have lots of different treatment options. So I feel like it's a big question, and I feel like we can come to it from different angles. So I'm hopeful that other folks will be able to chime in on some other aspects of suicide prevention we do at the VA.
I think one critical aspect of it is just knowing, trying to help the community as a whole. Megan, as you were sort of saying, help everybody to sort of be the eyes and ears for this, because it can't be up to, you know, an individual clinician inside an office and hoping that a person actually makes it to that office. You know, it's really about educating the churches and the schools and the community, you know, your local barber, you know, really helping people understand and be aware of these warning signs and how to direct people for help. The Veterans Crisis Line really is in some ways that low-hanging fruit. So if you happen to be a friend, a neighbor, a colleague who hears something that concerns you and you don't know what to do, doesn't matter if you yourself are a veteran, you can call that crisis line and have them coach you through what to do. So that's a really important resource. In terms of, you know, if they do, say, utilize the peer supports or some other mechanism, primary care, to get to a therapist office, once you're in a therapy office, there are evidence-based treatments for suicide prevention that have gotten quite sophisticated in helping an individual veteran identify their particular risk factors, rather than kind of taking a broad brush approach of treating depression. It's really looking at an individual's particular risk factors, which may be vastly different from person to person. So there's that level of granularity. I think the peer supports, and part of what got Josh hired, actually, going back about 5 years, was sort of a trial program acknowledging that there are a lot of people who need help who just don't want to, they're intimidated, or there's stigma around seeking mental health treatment. And so we really wanted to buff up our peer supports to try and ease the pathway into care, and to recognize that the pathway into care may take lots of different forms. Josh, I don't know if you want to talk at all about that.
Yeah, you know, one of my favorite things to do as a peer support specialist is meet with a veteran that's never been in the VA system. I work at the VA, but I also get my care at the VA. I'm proud of it. It's a big system, but I love meeting with veterans, letting them know their options. Yes, we are part of the healthcare system. There also is the benefit side. I'll meet with that veteran and kind of just let them know, you know, your time in the military, you're out of it, and now let's just figure out what your next steps are. And that could look, you know, that could be, you know, let's get you with a therapist. Let's get you with a psychiatrist. The fact that I can get somebody in front of a psychiatrist within 24 hours is pretty cool. And then also, if they're not ready for that and they're just looking for that next goal, that next thing, we can talk about education benefits. We can talk about the GI Bill. We can talk about voc rehab. We can talk about retraining. The greatest thing about the peer, I'll meet you where you're at, and we'll go from there. We'll have that conversation.
So one of the things you just mentioned, Joshua, is that you're able to get folks to see a psychiatrist within 24 hours. And I'm wondering, Jonathan, what does that look like when that connection is made with a person that needs a psychiatrist, and maybe that person has, you know, preconceived ideas of what does it mean to see a psychiatrist? Does that mean I'm a crazy person? What does that what happens once they see you?
Well, I mean, one of the wonderful things about working at the VA and about our healthcare, particularly here in Vermont, is just that our access is really fantastic. And so there are not people who are, you know, kind of wanting care who can't get care if they decide to take that step. You know, generally 6 months ago, it would have usually been a face-to-face visit. Now it's generally phone call or video connect call. I think we're pretty easygoing. And I think you're right. A lot of people do, you know, get anxious about talking to a psychiatrist, but the reality is that it can be the first step towards, getting, medicines to manage, chronic conditions, improve sleep, mood, anxiety, things like that. The VA has been doing mail-out medicines for many years, and so we're particularly good at getting medicines out to people when they are ready to take prescriptions, that we can mail those back and forth. One thing that Josh mentioned was the benefit side. I think it's important for people to remember that the VA has three arms. There's the Cemetery Association, there's VA benefits, and VA healthcare. And so there are some people who have only experienced VA benefits. And that is really a very different system than VA healthcare. And so I just hope people remember that we're not, it's not just about the benefits, that's one arm of the VA, but VA healthcare works very differently. And we're allowed to be much more flexible, by the nature of our mission. So don't judge us all based on one of those three arms, I guess is what I'm saying.
Yeah.
Go ahead, Josh.
Also, Jonathan brought up a really good point. I don't think any system could have prepared for this, but I am kind of impressed the way the VA, about a year ago, most providers received a webcam and a microphone, and we were like, what are we going to do with this? And they pretty much said, hey, you got to learn this VBC, the Video Connect. And that was about a year ago, and we thought, oh, okay. And we went through it, and we were prepared, and we were ready for it. Also, the mailing out, to be able to get your prescriptions mailed to your mailbox is pretty good right now. And the fact that we have those two systems up and running just is a testament that things are going in the right direction. And we worked out a lot of the issues before it became the new pandemic and the crisis that we're. So we are prepared for this, and we're moving along.
And I think Laura mentioned that we're seeing, I think, about 95% of, we're still doing very much the same volume of business that we were before the pandemic. It's just taking a different form. And so, part of suicide prevention is making sure that people remain in treatment and continue to get the care that they need. We are very much open. We have pretty much the same number of people that we had before this all happened, and we're available to provide the same, level and quantity of service.
I just want to reiterate the same idea of we're still open for the same services. So we've always prided ourselves on having walk-in access. I apologize, my printer is going off. So there we go, now it's not so loud. So we've always prided ourselves on having really good access and being able to walk into the clinic and really get seen that day. We still have that. We can still do that today. It's not necessarily going to be walking into the front door of the Burlington Clinic or walking into the front door of the White River Junction VA, right? But it's going to be picking up the phone and making that phone call as if you were going to be walking in. And we can get you seen and talking to a psychiatrist, a therapist, a social worker, a peer today, that day. And as Laura mentioned earlier, really our entire pool of providers has really expanded, because now we're not just confined with, you just came to Burlington, you can only see somebody in Burlington. Now we have this large pool of providers across the state. I really want to reiterate that we're still providing the same services, we still have the same access, and in some ways it might even be better that we have, more folks that can meet your needs, and we can do it in the same day for the most part.
So with 8 minutes left, I would like you folks, all four of you can answer this question. What is the VA doing, or how's the VA working to destigmatize mental health? And then each of you take a little time to tell me what you would say to a person who hasn't accessed services and who may be apprehensive about it. And we can start in any order. Megan?
So I'll go ahead.
I'm still thinking. That's
I'm going to try to keep this organized. The first question, one way to destigmatize. You can meet with a peer support specialist. A lot of them have been through the system. They're currently in recovery. They're happy to talk about that process. We also do groups, and in those groups have other veterans that have been through that process. They just haven't been through the certification training, but they're there to help. So veterans connecting with other veterans. is one way. And then also to talk about those, to put them out on the table. That is happening. We're lucky enough to have the National Center of PTSD right down in White River Junction. They have a really, really great website of different information, and it's veterans telling their stories from their point of view. So I would encourage anybody to, do a quick Google search on, it's called About Face, and it's veterans telling their story. What was the other question? I got wrapped.
What would you say to a person who hasn't accessed services who may be apprehensive?
That's a good one. I love sitting down, meeting with those Vietnam veterans, and they'll be like, no way, when I came home, that is not what I was gonna do. I want nothing to do with the VA. Their welcome home was not okay. I encourage each veteran who may have tried it and had a bad experience. I say this isn't your grandfather's VA anymore, and I truly, truly believe it. Give us another chance. If you tried, 40 years ago, I can almost guarantee that I haven't heard that many complaints. Yes, there are complaints, and I'll work with you on those and try to get that access. But most veterans that haven't accessed the VA in 40 years are very, very impressed with their care that they get. The federal government has invested a lot of money in making the access available and getting veterans what they need. I would say give it a try.
One of the barriers to getting mental health care, I think, has always been walking in the door. And one of the real advantages of this current situation is you don't have to walk into the door anymore. And so, talking to someone can happen in the privacy of your own home or in a place where you feel safe. And so that is a barrier that is not there right now. We do a lot of, putting mental health care out into the primary care clinics. So we have a lot of integrated care programs. The VA takes whole health very seriously. We do work as a team with the primary care people. There's good data that, taking care of your mental health helps with physical health and vice versa. And so, we do a lot of care coordination, a lot of consultation with the primary care people. And so it doesn't have to feel quite so different. We're part of the same team with the other folks that that you're seeing here.
I think also in general, I think many people who may have gone to therapy years and years ago, just speaking through that lens, there was more of, at least from my standpoint, a separation between sort of us and them, like the expert and the patient, and the expert is there to sort of give their wisdom down. And I feel like there's much more now kind of self-disclosure by therapists or other providers around their own mental health challenges. And, peers are an example of that, but even in traditional providers will say, mental health issues are common. They're more common than not. It's unusual to go through life without experiencing them. They're part of life. So I think just the whole approach to behavioral health in general, inside and outside of the VA, recognizing it's part of healthcare. It's part of taking care of yourself is taking care of your mental health issues, just like you would take care of your quote medical issues, and they're not these two separate, distinct things. And then just in terms of how the VA has changed over time, I think we've talked about a lot of examples. You never would have found yoga in the VA 20 years ago, or art therapy or rec therapy the way we're rolling it out. And again, kind of recognizing these sort of wellness activities is a big part of the way we're providing healthcare that I think is really different than it used to be.
And Laura, can you speak to the psychotherapies? I mean, we have many more skills-based and evidence-based psychotherapies. It's not traditional psychotherapy that people may have been exposed to 20, 30 years ago. And so that is also different. Absolutely.
Yeah. There's lots of very specific therapies that target specific issues that are based on scientific findings. And again, these are sort of stereotypes, but I do think that some people think of therapy and they think of this sort of black box mystery thing over here. They're not really sure what's happening, but there's the all-knowing expert, you know, giving their divine knowledge down to the patient, and it can go on for years and years and years. Now it tends to be more time limited and targeted, and people may have episodes of care. You know, you may develop a relationship with a therapist, work on a particular problem, go off and lead your life, and then you have this trusting relationship with them, and the next hurdle that you encounter that you need some help with, you can go back to that person and do another episode of care. So it's more, I would say, about some kind of problem solving, skills building, and hopefully feels less stigmatizing or sort of mysterious to people.
Megan?
You guys did such a great job. I guess one of the things that I think about, and I think both Laura and Jonathan really touched upon this, is I really think about the VA, and these are sort of what I think about, is it's a very holistic system. So as somebody said, we're very integrated. So it's not this idea that, you know, you have mental health services over here and you have, you know, medical, you know, physical health services over here. We're very, very integrated. And I also like to think that we also address a lot of I say we have a social mission, so we address a lot of social issues, if you will. And so how sometimes those things can be driving our emotional or mental health, right? So back to this whole idea of, you know, being in a pandemic and feeling like we're struggling financially. These can really feed into some of those things, and that can then exacerbate some of our mental health and exacerbate some of our physical health. So I think just this idea that we're a really holistic healthcare system and we're integrated in many ways. And by seeing one provider, we can get you connected to the rest of the system, depending on what you may or may not be struggling with.
Well, I definitely would like to thank all of you panelists and folks that have joined us today. I think that's, as the mayor had said previously, it's great to have you folks on, especially before Memorial Day. I'm hoping that there are folks who access VA services who will get a chance to watch this and may get information that they previously hadn't known. Definitely, I would like to hear feedback from anyone who watches this, as well as any ideas you may have for future webinar topics. You can email them to the recovery@burlingtonvt.gov, or you can call us at 802-755-7239, and be well and be safe.
Be safe.
Thank you so much,
everyone.
Thank you.